Hi, this is Patty and Rada with HIMSS, and today I'm with Scott Galbari, Chief Operating Officer for Lyniate. Welcome, Scott.
Hi, thank you. Thanks for having me, Patty.
So Scott, tell us a little bit about your company, Lyniate. When was it founded and what does it do?
Yeah, most people don't know our name Lyniate because we're better known for our flagship products, Rhapsody and CorePoint. We've been in the industry for the last couple of decades. We have over 40 years of experience in healthcare interoperability, and our technologies essentially enable connecting data between different systems across the healthcare ecosystem. And so payers use our technology, healthcare IT companies, people building software applications, providers, public health, all use our technology to help connect, not only integrate, but make the systems interoperable between each other.
Okay, great. So can you talk about what's been happening the last year and a half, especially interoperability is such a big thing. We've got telehealth that's sort of expanding, all the touch points of where data needs to go. So can you talk a little bit about, what's been changed in the last year and a half?
Yeah, there's a lot happening. I mean, obviously the pandemic created all sorts of new avenues for delivering healthcare. So people are getting care in different venues today. And with all the telehealth, obviously there's the need for new systems that are now needing to connect into the existing EHRs. And so if you have an interaction through telehealth, you may not actually get that patient's record connected with the rest of their longitudinal record. So there's a lot of challenges in interoperability just because now you're delivering care in a lot of different settings that are not your traditional hospital settings or clinical settings. Beyond the pandemic, there's a lot of focus on the ONC and CMS interoperability rulings. People are trying to implement FHIR-based standards in order to make systems more interoperable and to allow more access to patients' information, to give consumers, patients, the ability to have more ownership over their data.
Right, so let's talk a little bit more about that. So, the patients, we've got consumerism in healthcare now. Patients need access to their data as well, so they can be more engaged and empowered. So talk a little bit about more how, the focus on the technology, to allow that to happen for patients to get the access to their data in real time.
Yeah, that's a great question. I mean, we all want to, if you've ever gone through a healthcare encounter, you know that you want to have access to your information. And it's always been challenging in the US for us. So if you go into the doctor's office and you go to see a specialist, getting that information carried between those different providers can be very challenging. So we all would like an easy solution, right? And so now there's the adoption of FHIR and trying to get the ability to have more open access to the information in the EHRs so that now you can, as a consumer, can have applications that can use APIs, publicly accessible APIs, to get your data and get it down onto a personal phone, as an example. So you now have, the ability to do it from a technology perspective. There's still a lot of challenges from, just we as consumers are not accustomed to taking that responsibility. We've grown up in the healthcare system where somebody else always managed your patient file, your record. Used to be, a physical file. And now when you have to take that responsibility, it's something we have to learn how to do. How do we take more of that ownership and responsibility for ensuring that record's accurate and that we take the time to curate it and make sure that can be usable at the right time when you're seeing the next person in the care cycle.
Right. So talk a little bit about what complexities that have been sort of new in the last year and a half that interoperability has to really address.
Yeah, I think the biggest thing that people are starting to experience is that when you start to get systems that need to be interoperable outside the four walls of a hospital or a health system, you now created a much bigger problem to solve. Now, it's great because you can give access to all different locations. We just talked about getting access on a mobile phone to an application. But now if you imagine I'm going to use a mobile phone and I'm going to try to connect to my health record or information that may be inside the four walls of a hospital's data center. Well, now you've just created a big entryway that you have to open up to the outside world. And if you don't do that in a secure fashion, you now created a whole lot of challenges and a lot of risk for not only the patient, but you as the provider of that information. So one of the biggest challenges that we're seeing is how do you get access to that information in a safe, secure manner? And you're starting to see more adoption of cloud technologies because now you're looking at, if you don't have everything on premises, local to where you have all the different systems and you have them remote in different locations, you now can get some benefits by putting things into the cloud, and you can start to use APIs that are managed through the cloud in a way that you can broker that in a secure fashion. So we see a lot of focus on security and trying to make sure that once again the data can be exposed, but in a secure fashion, complying with all the privacy regulations at the same time, and then also trying to adapt towards leveraging infrastructure outside of the hospital's data center.
So how do you remove that sort of burden on providers, right, on hospitals and health systems? Is that something that the technology, and your partner, take care of so they can focus on taking care of the patient?
Yeah, that's a great question. We're seeing more and more of a shift within the hospitals and health systems who traditionally had IT staff. They built up their data centers, and they're recognizing that they're making huge investments in these areas, and they are not focusing as much on the clinical care workflows, and their IT staff are not necessarily spending as much time on how do you improve those workflows and more time on the infrastructure. So what a lot of hospital systems are starting to recognize that maybe they should essentially outsource or look to SaaS providers. They're looking to companies that can provide their technology in the cloud, so they don't have to worry about how do we manage a secure platform, how do they upgrade it, how do we manage it, the security for it, how do we make sure that it's monitored, you troubleshoot it, everything like that. So they're starting to move that up in the cloud and relying on organizations like ours as a partner to essentially take that responsibility for them.
So now let's look into the future. So 6 months to a year, what kind of challenges and what can we hope to see out of interoperability and cloud vendors?
Yeah, one of the big, as you look forward, we talk about all these different data sources coming up. Everyone, we're at HIMSS, we're talking to all these different companies who have great ideas for how they can continue to help improve information technology in healthcare, but all of them are consumers of data and producers of data. And there's this massive volume of data being produced now. And so the next layer to really start to look at is not only can we get the data between systems and to make sure that they understand what that data means, but how do you get insights out of that data? How do you start to find the things that are meaningful through the noise? Because you can imagine if you have your heart rate monitor and you're constantly sending heart rate signals in, well, does your primary care doctor need to understand every one of those data feeds that's coming in? Probably not, but trends in there are pretty interesting to them. So the next level of interoperability is going to be focusing on adding more of that intelligence. How do you find the important information of all the data that's flowing between these different systems? And it's obviously growing at scale. I mean, as I said, all these different systems, everyone's generating more data, which is great. We love all of our smart devices. We have everything's connected. The Internet of Medical Things is just growing just as quickly as our, in our home, where we have our refrigerator connected to, our smartphone, right? And it's happening in healthcare as well. So finding ways to get that data in and out of the, the ecosystem that exists today, and then figuring out how to do something meaningful with it is the next layer.
Yeah, and that's a big challenge that we're all facing. Great, so thanks so much for your time, Scott.
Yeah, absolutely. Thanks for having me, Patty.